As you can tell, I too have moved through the decades of changes in my skin and how I've cared for it, as well as have worked with thousands of clients on treatment plans customized to their skin type, skin age, and goals. Are you wondering how to best care for your skin in each decade of your life? I feel your pain. With so much information to sort through, how do you even know where to begin? In this video, I'm going to walk through my general recommendations of what to do in your 20s, 30s, 40s, 50s, and beyond to keep your skin looking its best. Hi, my name is Kim, and I'm a master esthetician and owner of Estetica Spa. My goal is to give my clients results that make them feel more confident in their own skin. With over 15 years of experience in aesthetics, I've seen a lot of advancements in the skincare industry, and I share them here on my channel once a month. If you haven't yet, hit the subscribe button below. Okay, so let's talk about in your 20s. We hear complaints from this generation about acne scarring and even new hormonal acne. So you might want to start having monthly treatment facials or hydrofacials to help keep those pores clean and skin well exfoliated. But the number one rule is wear your sunscreen. Sun damage accounts for more than 90% of your skin's aging. If you do nothing else during this decade, at least wear your sunscreen. This is also a great time, if you haven't already, to start with a professional grade skincare regimen and use it every day. Wash your face and apply your products morning and night. Once you start this habit, it really only takes about 1 minute in the morning and 1 minute at night. It can be very fast. Next, we are actually seeing a lot of 20-something-ish getting Botox for prevention of wrinkles. I wish I had this option when I was in my 20s. Along with your treatment facials or hydrofacial, you probably might want a few microneedling treatments each year to stimulate cell turnover and collagen production and smooth out any texture issues. As well as, don't forget the medical grade skincare. You should be using a vitamin C serum during this decade for brightening and protecting the skin against toxins. Again, get it from a reputable source, an esthetician or dermatologist, so you know the quality and will have enough of an active ingredient to actually work. This should be disclosed as well on the box. Recap in your 20s, Botox for prevention, regular facials, maybe a little microneedling if you have some texture issues, and then home care with vitamin C and SPF. In your 30s, you might start to see some early signs of aging, such as fine lines around the eyes or in the 11s between the brows. Discolorations might start to show up, or some forehead creases. Even clients who've been diligent with skincare will start to notice some fine lines forming. Neurotoxin or Botox for sure during this decade, and possibly a little lip filler to restore some volume loss there. Remember, this can look totally natural. It does not have to be over the top on the lips. We prefer a natural lip. And 3 to 6 IPL laser or microneedling each year during that decade to speed up collagen production, reverse some of the damage done in the prior decades. Regular monthly treatment facials or hydrofacials, again, those are always recommended during every decade, as well as we will want you using some medical grade skincare at home. With retinols, it's not optional anymore. After you're in your 30s, you need to be using a retinol. Don't forget about checking the percentage. Get with your esthetician or dermatologist to know what that is. And SPF. Recap in your 30s, Botox, filler, regular facials, possibly some microneedling, home care with retinol, and SPF. Your skincare products should disclose on the packaging what the percentage of retinol is. So be sure you're checking so you can see what that is. Any good medical grade skincare will disclose the percentage of retinol. We generally like to start our clients at a lower percentage and acclimate up to a higher percentage. So you might start at a 0.25% and then move up to a 0.5 and up as high as a 1%. and then onto a tretinoin. Okay, the decade of 40s. Priorities we hear from our 40-something client is starting to see some fine lines, laxity, possibly some volume loss in the lips, and sun damage is starting to show, and a lot of dull skin, which may be from a lack of moisture or a buildup of dead skin cells, hormonal changes that are happening, and cellulite. I'll touch on that at the end. Neurotoxin, Botox for sure is recommended in this decade, as well as filler if you're starting to see some volume loss or fine lines. And then 3 to 6 IPL or laser treatments, microneedling. During this decade is also important to speed up that collagen production and reverse some of the damage done in the decades prior. We love to see you regularly for monthly treatment facials or hydrofacials. Your skin will love you as well. We'll want you using a medical grade skincare at home with that retinol in it. And yes, anyone 30 and over should be using a retinol derived skincare at home, and know what the percentage is. Don't just grab one off the shelf at the big box store, and because it says retinol, think it will make a difference in your skin. Use a quality product that clearly states the percentage. Get it from your esthetician or dermatologist so you know that it's working. And of course, always use your SPF every day, even if the sun's not shining. So a quick recap of your 40s. Botox, filler, regular facials, hydrofacials, laser, and a good home care with retinol and SPF. Next, let's talk about those in their 50s. Generally, this is the time when we start really noticing the aging setting in. Those years of not taking care of our skin and sun damage really start to show. And often women in this age group start to notice the aging process of the neck and chest along with their face. So may want to include this area in their treatments. The first thing we usually recommend is some neurotoxin, Botox. That remains an important part of the arsenal during this decade. And filler if we're starting to see some of the sagging, volume loss, or fine lines. Yes, we do fine line filler, and it looks amazing and helps our lasers work just that much better. We can still do a lot with the IPL, our laser, Tixel, and microneedling during this decade. And it is always recommended, if not to reverse aging, at least to speed up the collagen production. Also, regular monthly treatment facials or hydrofacials to keep that skin bright and the dead skin cells sloughed, as well as we want you using medical grade skincare with vitamin A or retinol treatment at home, and your SPF every day, even when the sun's not shining. Again, recap: Botox and fillers, regular facials, hydrofacial, some laser, and good home care with retinol and SPF. Okay, I'm going to start with the 60-plus-year-old age group. When advanced aging, skin laxity, deeper wrinkles, and volume loss are seen, I get asked all the time, is there anything I can do? The answer is yes, but we all must be realistic in our expectations. We can't turn back 40 years, but we certainly can help reverse and correct some of the signs of aging. Something small that can really help is a little cheek filler in the cheek area and a little filler in the lip area. Believe it or not, cheek filler is to lift the sagging jowls, and your top lip starts to slip away in your 50s. Just that little change can make a huge difference. Generally, we are going to recommend also some laser, chemical peels, microneedling, or Tixel treatments to accelerate the collagen production, fade age spots, soften lines, tighten skin, or maybe a combo of those. Regular monthly treatment facials or hydrofacials to keep the skin bright and dead skin cells sloughed is also recommended. We like to do the filler in a subtle way just to keep it looking natural. Also possibly might recommend some neurotoxin, Botox, as well as we'll want you on a medical grade skincare at home with vitamin A or retinol. And of course, use your SPF. Even when you're not in the sun, you need to wear your SPF. If we hear our expectations are above what we might be able to achieve, we'll recommend a plastic surgeon for a surgical lift. Recap: laser and Tixel, filler Tixel, home care with retinol and SPF. A couple of our favorite retinols and SPF for this age group are going to be our Meridian Illuminate that has retinol, but it also will help with brightening. So those age spots will start to diminish with that. And then for our SPF, we've got a great Jangarini Physical SPF. And for reapplying throughout the day, our recommendation is going to be our Color Science Sun Forgettable Brush. It's amazing, easy to apply throughout the day, and it has an SPF of 50. So those are our recommendations for that age group generally. A little side note on cellulite or fat pockets. Starting in this decade of life, many people find that they have stubborn fat deposits or do not respond to diet and exercise. This might be among women after childbirth age, or women experiencing normal changes in metabolism with aging. Cellulite's just super common. We have a state-of-the-art body contour cellulite reduction equipment. See my smooth cellulite and tighten skin video linked below for more information. Okay, so the answer is yes, every age needs to take care of their skin. Everyone is unique in their own way. We provide complimentary consultations and customized treatment plans for every client based on their needs and goals. Next step, just click the link below for more information.